Jezewska. It's a pleasure to introduce them. Hines and Katarzyna Jezewska, they are from the European medicine agencies. Philip is currently working at the EMA in the Regulatory Science and Innovation Division. He has been involved in the drafting of the strategy of the EMA in the next 5 years and in the Horizon scanning function. He's also doing a PhD at Maastricht University, so I think he's a perfect speaker for this webinar because he can also give, the angle of a PhD student at the same time. And Katarzyna, or Kasia, I think if I can call you like that, she's a talent acquisition officer at EMA. She has a master's degree in human resources management at the University of Leeds. And then she has been involved in different activities, including a training at the joint, she was a training manager at the Joint Research Center of the European Commission. So it's a pleasure to leave the floor to you, Philip and Kasia, and please try to do the miracle to keep your talk all together, 2 speakers in 15 minutes. Okay, we can give you 2 minutes more, but try to keep the time because otherwise we will be too late. Thank you.
Thank you.
Thanks, Luciano. I'll just share my screen. And I hope you guys can see this. Yeah, so thanks so much for having us, Luciano and others. And thanks, Christoph, for doing an excellent introduction into the Commission. And we are representing the European Medicines Agency, which is a devolved agency of the Commission. And don't ask us what that means, but it means we're independent. What do we do here at EMA? And you've probably heard us mentioned on the news, some positive and some negative coverage recently. We do quite a number of things, but the sort of 4 major things that we do is to facilitate the development and access to medicines. And that's, for example, providing guidance or scientific advice on how companies or medicines developers should go about developing their medicines to make them sort of most relevant to patients. We do, of course, evaluate applications for marketing authorization. That's our bread and butter, as it were. And we monitor the safety of medicines across their life cycles. That's our pharmacovigilance activities. And then finally, we're an information source, and we hope to provide reliable information on human and veterinary medicines in lay language. So that's briefly what EMA does. And I understand you're all pharmacy students or thereabouts, and no doubt very successful pharmacy students if you're attending this seminar. So I'd imagine that if you were applying for EMA, you'd be looking at a scientific post. And there are a number of scientific roles at EMA, both in the human and veterinary medicines areas, but you'd be doing such jobs like procedural or scientific management of procedures or applications for marketing authorization, for example, and then assisting our scientific committees who do the review of these applications and answering any scientific questions that they have. You could either be working on pharmacovigilance, you could be doing some inspections work to do inspect clinical trial sites or manufacturing sites or arrange the inspections, or quality. So, for example, working out whether excipient X in a new medicine is acceptable or not. But there are a number of different scientific roles at the agency, and we are always looking for scientists, and particularly pharmacists, actually. Then a bit of what life is like at EMA. I mean, similar to what Christoph was presenting, EMA is a diverse international working environment, although of course only international to the EU borders. But that means that people have usually relocate their lives to Amsterdam in this case to work at EMA, and therefore it's quite a social environment. We have we've got a shiny new building with a bar on the 18th floor that's got a great view, one of the best views in Amsterdam. That's a big perk. And the colleagues that we work with are also very driven, very well qualified. And so there's a very high level of professionalism in our work. And so from an early career perspective, it's a great place to learn the sort of softer working skills that you need in your career, but to a very high standard. And I think stands you in good stead for the rest of your career. And then, like I said, it's stimulating work on a wide range of scientific and regulatory roles. And there's always opportunities to do work beyond what's included in your job description. And then finally, and most importantly, you will have a high positive, hopefully, public health impact. And I think there were the sort of 4 key things that I thought made EMA stand out, perhaps from other public sector employers, but a lot of these apply to the Commission as well. And you get to work with fantastic colleagues such as Katarzyna, who I'll hand over the floor to now before we answer any of your questions at the end.
Super. Thank you so much, Phil, for the intro. I think you can move on to the next slide. Just to kind of briefly walk you through the selection procedure process. And before I actually do that, I do want to mention that it's a very lucky coincidence that we're having this conversation and we're participating in this meeting right now, when over 30 traineeship posts are on our website available for your application. And there are many of them that are calling for a degree in pharmacy. So I do hope that whoever is participating in today's meeting is going to have a look and see if they find anything interesting. And in case that's the case, to give you a quick idea how the recruitment process looks like. So of course we have a selection committee established, and that is true for the traineeships, but it's mainly true for the selection procedures for contract agents and temporary agents. So you'll see our vacancies always being posted on EMA Careers. I do strongly advise you to set up notifications so that you can receive alerts straight to your inbox if you find the work that we do interesting and you would like to contribute. It is important before you apply to make sure that you meet the eligibility criteria, as we are pretty strict on those, and we definitely check before progressing everyone to the next stage, which is the shortlisting of candidates. It is done usually by the review of your applications, and then again we have some short guidelines available on our website. How to fill in your application if you decide to do so, how to fill it in so that you are successful in coming through to the next stage. Should that be the case, you will be invited to a preliminary assessment. And that's usually some kind of a test. It might be a written test, could be multiple choice, could be a video interview or a presentation that you will need to prepare. It really varies from one opportunity to another, and it's really tailor-made to assess your skills and competencies for a particular role. And then of course the top scoring candidates will be invited for an interview with us. What is important to note, I think Phil, if you could go to the next one. Exactly. So after the final assessment, what is important to understand about EMA, as it is also for the European, it's true also for the European Commission, is that seeing the selection procedures advertised on our website does not mean that there are immediate vacancies available sometimes. So we might conduct a selection procedure because we know that in the future we'll need particular skills or competencies or candidates with particular profiles. So the way you want to look at it, basically, it is being appointed after successful interview, being appointed to a reserve list may result in a job offer, but it might not immediately, which basically means that, for example, a successful candidate might be appointed, but we can also reach out to you, let's say 6 months or 8 months after an interview, when an appropriate opportunity comes along, to see if you are still interested to work for the EMA, whether you are available, etc. And if that's the case, we'll move forward with a particular job profile. So to kind of sum it up, it is important, well, from my perspective as a recruiter, is important that to tell you that you should be on as many reserve lists as possible for different profiles, of course, as long as you meet the eligibility criteria, because we do use the reserve lists heavily. You should see them as basically as talent pools that we draw qualified candidates from to fill our vacancies as they come along. So I think that's the most important bit. If I can have the next slide. Well, this is just a screenshot of our website. You can find us at the careers.ema.europa.eu. Please do explore the page. It's been updated a little bit. You can read about the opportunities. There is, as I mentioned, there are guidelines about the application process, how to apply successfully and go to the next stages. And there are also contact details in case you want to reach out to us. Can I have a next slide, please? Yes. As I mentioned, we now have 31 traineeship posted, which might be of interest to you. Just from the just before this meeting, I pulled up just a handful of those that actually require a pharmacy degree, and those would be traineeships in good clinical practice inspections, in availability of medicines, environmental risk assessment, and the real world data. And there are actually more profiles that are calling for a degree in pharmacy. So I strongly recommend you having a look at it. And as you can see, there are many different profiles. So there are scientific jobs, but there are also IT jobs, corporate support jobs, you know, those that are actually supporting the scientific outputs. So there we have a wide range of different profiles that we are looking for. Can I have a next slide, please? I'm mindful of the time. That's it. Okay, very good. I think we managed.
Excellent.
Thank you to both of you. Really very interesting, very also practical. So I'm sure that you know, some of the participants online are very happy to hear that there are some vacancies announced on the website. So I'm sure they will go immediately to check these eligibility criteria. As you said, Kasia, they're very important. So I don't see for the moment questions in the chat. I encourage again all participants to write questions in the chat. I'm sure you will have, so don't be shy. This is, I think, is a good opportunity for you. And maybe I ask also Jos and the other panelists also, if you want to ask any questions, please. This is the moment to open the discussion for the second. Okay, the name of the website, you can use Google, my dear Mario Garcia. It's very easy to find the career option of EMA. So I don't know if there are questions also from the panelists. Yeah, the website is easy to find. Okay, thank you, Kasia. She shared in the chat. Thank you. In general, maybe to break the ice, maybe I can ask to all of you, to the speakers of this first session. I mean, one of the questions that usually I get, you know, from young people, students, or young graduates, you know, which is the best path they should take, you know, after, let's say, a degree. They aim at having a degree. Online today, we have students and graduates not only in pharmacy, but also in biotechnologies and also in medicine. So we spread the world also to this sector, to the biomedical sector. And very often the question is, what to do after. I mean, there are in many European countries, of course, master's degrees, which can be taken, after the first master's degree, more professional path, etc. And this is one of the possible paths, or a PhD. And this is usually a big kind of decision, because of course we know that a PhD can last a few years, is a big engagement, etc. So how would you, would you try to advise these young people? I mean, is it a good idea to try to really look for a job, with the authorities, as we mentioned, so European Commission, EMA, and other authorities? We can also mention EPO, for instance, European Patent Office. We are going to have another webinar soon, also with them. Immediately after a degree, or you would recommend them to take a PhD or to complete their preparation with other degrees? I don't know who would like to reply.
Can I answer on that one, Luciano? This is Christoph speaking. It's the first question. You called it an icebreaker, but I found it one of the most difficult ones to answer. And I will give you my personal answer. When I was in the last year of my studies, I had the choice between doing a PhD research into radiopharmacy, which was one of my big interests at the time, of starting to work in pharmaceutical industry. For me, I must be very honest and very blunt. Working for the authorities was not even on my list. So what I did, I made the choice to work for industry, did an internship, switched jobs, learned a little bit on the different aspects, and gradually found my way into a niche area that I thought for me was very nice. For me, the choice and where I am in my career is there because I switched, because I reflected at given times on what do I want to do. Do I want to do research? That was not for me. Research and academia was not for me. What do I want to do? Well, I like working with legislation. I like working as an expert, not as a head of a team or a manager. That was not for me. So my career path followed that a little bit. So in a sense, to still give an answer to the question, I would say, if you can do internships, do jobs, don't hesitate to switch jobs, to reach out, to talk to people on their experiences, and take the time when you're in a job to reflect carefully on expectations. What do you want? Where are you good at? What are your strong points? What are your weaker points? And that will guide you through your career. When Josse asked me to do this presentation, I said, why would you want me? Because my whole career has been one coincidence after the other. There's no logic in this, but most careers are like this. So I hope that's still part of an answer. It has to do with reflection, with gaining expertise, and with careful hindsight, I would say. Thanks.
Thank you. Maybe before I give the floor to Sibel, maybe Philip and Kasia, would you like to also maybe answer to this question? How do you feel?
I can give a super short answer from the recruiter's perspective, someone who also sits in the interviews. I think there is no right way, but we see that, for example, someone might come as a trainee to the EMA and then they leave to work for the industry, and then a couple of years later they are coming back, with a new set of skills and a completely different also perspective, and they want to come back for the and work for the authorities. So it really it does definitely enhance your skill set, for sure. It broadens your perspectives. So it's just again, as Christoph said, I wouldn't be afraid of switching and thinking that you have to stick to the chosen path. If you start with the authorities, that's it. You are set for life. I don't think that's the case. Maybe Philip.
Thank you very much.
Say something on that.
Yeah.
Yes.
Luciano, the $1 million question, right? The PhD or not the PhD? No, as Katarzyna said, there's no right way in terms of PhD or not PhDing. I guess the advantage of not PhDing initially, once you've got your master's, is that you can then find out what you're interested in and build up a bit of expertise such that you can more easily perhaps get a PhD in whatever field you're interested in. Although having a PhD does obviously broaden your skill set and give you a sort of a label which maybe opens up doors in future life, so it's difficult. Personally, I'm lucky in that I'm doing an external PhD where I'm working at EMA full-time, but just publishing papers sort of on the side, and that's counting towards a PhD in the end. So that's a Dutch, the Netherlands, and I think maybe some other countries do this external PhD option as well.
Thank you, Philip. And this is actually also an important point of the answer, in my opinion, because indeed there are different types of PhDs. I mean, you can do a PhD and work in very basic science, or you can try to do an industrial PhD, an external PhD. In different countries, there are still a little bit different regulations, but I mean, I think this is also a good idea, you know, to take a professional doctorate and not maybe if you, I mean, if a person maybe who is online today and is interested in what you presented, even taking a PhD, maybe he or she can consider, you know, not a very basic science PhD, but something like you are doing, Philip, which I think is very interesting. So we have just a few minutes, but Sibel, a very short question and short answer by the speakers.
Yes, it is short. My question is going to Christoph. When he mentioned the main task of yours, you mentioned the export authorization of COVID-19 vaccination and vaccines. So all the vaccines, or you choose the important ones? So what's your policy to decide on this?
Well, it's actually I'm quite happy to talk about this actually, because it's a very interesting file, because it's in essence not a file for public health authorities. I work for DG Santé, so the public health part of the commission, but the export of vaccines is mainly about international trade and international trade issues. So for us, it was quite of a challenge to work with counterparts throughout the commission, like people in the Trade Directorate General, in the industrial policy part of the commission, DJ Grow, even with people from the research side, DG RTD, to make a policy and to say, okay, how will we manage this? Basically, what happens in a nutshell is before a vaccine can be exported out of the Union, a request needs to be made to the national authorities, and they need to check with us, which sounds like a lot of administration, and we need to do it in 2 working days. So we need to take a look. Okay, we have a request from AstraZeneca to export 1 million doses to the United Kingdom. Do we accept this or not? And that's the other part that was interesting, because in that dossier, I worked in a direct line with the cabinets, with the policymakers at high level, which is of course not the usual things you need to do. My point of bringing this here today was you can have in your career an expertise field, but still get really ad hoc dossiers, really get ad hoc moments in which you can do very relevant public health work, and that's, well, for me at least, that's very rewarding to see that happening and to really have an impact on even international policy. And just anecdotally again, some of the numbers that were made on my computer in this bedroom near Brussels were made were used in discussions between Ursula von der Leyen and Boris Johnson. I mean, if you get those kind of phone calls that's really very very rewarding. So thanks for the question and for giving me the opportunity to take that side step to
Thank you, Christoph. Maybe just
Luciano, could I still ask one?
Yeah, that's what I wanted to ask you. Yeah.
I was wondering, for these candidacies, do you need to be an EU citizen, or are these all open to everyone, from all over the world? And secondly, are there sometimes quota on member states, or is it just competencies that are the main criteria for selection?
And age restrictions, if they have.
Well,
And we still apply.
Well, fortunately for me, I think age restrictions are not there. I will start, and perhaps Katarzyna or Philip can fill in. I think European Commission policy and European institutions policy is rather encouraging diversity and encouraging as broad as possible recruitment on the basis of the competencies I just shown. And whether those competencies are in the body of, let's say, a balding 40-year-old guy like myself, or they are in somebody that is just out of college, it does not make a lot of difference. So quota for member states, no, there are not, and luckily for me, I might add, because I'm Belgian, and as a lot of the institutions are based in Belgium, there's a rather big proportion of Belgians already there. But there are of course some rules for some committees or some organizations where it's really important to get that balance. But off the grid, and especially for policy officers' functions, there are no real quota foreseen. It's just that you need to be best in some of the tests, in some of the abstract reasoning, computer testing, and so on. You need to be selected out of a number of people. That is the difficulty. I cannot answer on the question on Europeans or not Europeans. For my selection, I know that being a European citizen was a requirement, but I don't know whether that's the case for all functions. So Katarzyna, perhaps you can help me here a little bit.
For the EMA, it definitely is an eligibility requirement that you do have to hold European Union nationality, and well, there are also language requirements. So English at least C1 level and an additional European Union language. Of course, there is a military service, but that's that's like one of the further points. And of course, you need to meet the criteria of the vacancy notice, meaning that if the vacancy notice is calling for a degree in pharmacy and you don't have it, then I'm afraid this will exclude you from the selection, unless they specify that it might be pharmacy, medicine, and let's say a related field. So of course, I mean, if it's, let's say, for the sake of argument, business administration, that's probably not gonna cut it. But if it's another one, then the panel always looks through those, and most of the time the candidates are accepted. But yes, before application, always please do have a look at the eligibility criteria.
So thank you very much. So unfortunately, we have to move